Valentine's Day?
So a lot of women are thinking about intimacy and connection during Valentine's Day, and it's very, very important, and hormones play an important role in that. And I'm glad we're having this conversation because I think we need to normalize it and have more women talk about this stuff, especially with their girlfriends and with their healthcare providers.
What age group are we talking about here?
It can start as early as 35, 36, 37, and go all the way up to in their 70s, yes.
And so when you talk about hormones, what do we look for? Because I think a lot of folks, I think tiredness is one thing that comes to mind that we think
fatigue is a big one.
Just
yes.
age, right? But it's not.
Yeah, so aging is totally normal, but suffering is not. So when you have things that are conflicting with sleep, intimacy, brain fog, weight gain, and conversations with friends and stuff, and fighting with your kids and just feeling off, that's when you have to have the conversation.
Do you think that, I mean, we could talk about it, but when you're in it, people don't necessarily recognize, oh, that's what I'm experiencing. How can we make sure, and not just for women, but for men too, that they may notice that their partner's going through something?
Yes, so these symptoms can sort of whisper at first, and then they start screaming and yelling. I have a lot of clients and patients that come in and they say, I just don't feel like myself. All my tests are totally normal. What do I do about that? So the first thing I do is reassure, and I also listen, because a lot of these weird complaints that they may have, like shoulder pain, joint pain, and then obviously all the things you hear, fatigue, weight gain, brain fog, they all play a role. So testing, we do a lot of testing, we do a lot of guidance, and then we have to undo a lot of the myths around hormone replacement so that people feel comfortable and empowered to make a great decision.
Now, when you say, that's the other part of the conversation, hormone replacement therapy, what exactly does that mean?
So it means that you need a personalized plan, but for most women, it's estrogen, progesterone, and also some testosterone. So yes, testosterone is a male hormone traditionally, but we need it as well. And it helps with libido, your mood, and also brain fog. All of the things, all those symptoms can be minimized or alleviated with some of these medications.
When people come to you about these symptoms, what surprises them the most when you speak to them about what they're going through?
That they're not alone. That what I tell them, that what you're feeling is very common, but that doesn't mean that it's normal, and that there is help out there. Because for many, many years, hormones have been demonized, and we're very scared about breast cancer, about some of the side effects, blood clots, heart disease. But thankfully, the FDA has come to their senses, and they're changing those recommendations, and we have a new hope. And I see it in my office because I've had an explosion of new patients who are seeking treatment, which is really, really important.
What can the partner do? How can the partner help them?
So they can understand, they can validate, and they can communicate. So talking about them in a gentle way, like, I've noticed this change. How are you feeling? I saw this woman on Fox 5 this morning, and she was talking about hormones. Is that something you're going through? I think women are talking a little bit amongst themselves, and that just needs to expand to your partner, and you need to be more confident about asking questions.
Thank you so much for talking about this on Fox 5. Where can everyone find you?
I have a practice in Rockville, Maryland. It's the Osteopathic Center for Healing. You can find me on Instagram at my name, Jennifer Galarson, and then my website is yourbestlifewithjennifer.com.